Okay, welcome back. Good morning to all of my dear viewers. So in today's session, we are going to discuss a very important topics of community medicine, and the name of topic is prevention of cancer. So in today's video, we discuss only about the primary prevention. In the next video, we talk about the secondary prevention. So how we can prevent our population or the citizen of our country to the development of cancer. The first thing is that we have to focus to control the risk factor of cancer, and the common risk factor of the cancer is tobacco smoking. So our first aim, our first target is to control the tobacco use, either in form of tobacco chewing or smoking. So the first thing is to control the tobacco along with the alcohol consumption, because this alcohol will also contribute for the developments of liver cancer. The second thing is the improvement of personal hygiene. The first thing is control the tobacco and alcohol. The second thing is personal hygiene. This personal hygiene decrease the incidence of cervix cancer. Okay. So the third thing is the reduction, the amount of radiation, including the medical radiation. Fourth thing is protect worker from the exposure to industrial carcinogen. Okay. Fifth thing is the immunization against the hepatitis B and the human papilloma virus. Fifth is the testing of food, drugs, cosmetic for carcinogen. Next is treatment of precancerous lesion, and the seventh is legislation. Legislation means making law to control the tobacco use and the alcohols, and educate the people about the danger sign of the cancer. So overall, what I am telling to you, our first target or our first goal is to prevent the cancer at a primary level, I mean a risk factor level. So we try to reduce the risk factors in our population by cessation of smoking and alcohols, and through personal hygiene they protect the developments of cervix cancer in females. And what we do, we can also educate the people about the danger sign of cancers. So what are the danger sign of the cancer? The first danger sign of cancer is the presence of lump or the hard area in the breast. What? Present of lump or the hard area in the breast. Change in mole, persistent change in digestive and bowel habits. So what are the different digestive and bowel habits? Digestive changes like burning in upper abdomen after eating every day. So what happens if any patient having complained that he feel burning in epigastric region after eating, then it may be a sign of cancer. The other thing is the burning sensation behind the sternum, we also called as a hot burn. A stomachs feel tight after a small bowl of rice. Patient come to OPD with a complaint that they consume a very little amounts of rice or any food materials, and he feels that their bowel start to be bursting. So these are the common complaints that patient come to. That these are the common complaints. So what are the more complaints? Difficulties in swallowing, loss of appetites, persistent nausea and vomitings. So these are the digestive changes. Patient come to OPD with a complaint of there is a burning sensation over the epigastric region. They not feel hungry, I mean loss of appetites, burning sensation above the sternum, I mean a hot burn. And what are the other things? In case of bowel habits, patient come to OPD with a complaint of persistent constipation, persistent diarrhea, feeling incomplete evacuation after the passing of stools. So here patient come to your OPD with a complaint that, sir, I having diarrhea for 1 week, I having a constipation for 1 week. So these are the common bowels complaints. Some more complaints like persistent cough or the hoarseness of the voice. Every month blood loss with stools, swelling or the sore throat which does not heal, which does not heal. Okay. Swelling or the sore throat which does not heal. Okay, this is due to the weak immunity. So this is all over the primary preventions. What are the goal in primary prevention? We try to reduce the risk factor, and the most common risk factor is the tobacco chewing or the tobacco smoking. Second thing is that we educate the people about the danger sign of cancers, like if anyone feel burning sensation over the epigastric regions, they having a persistent diarrhea for more than 1 week, persistent constipations, now presence of bloods in their stools. So these are the common danger signs of the cancer. If any patient come with complaint of these things, we can suspect cancer in those patients. So I hope you can little bit understand the lecture. Welcome back in new session.